Over 30 million men worldwide take sildenafil every month, and millions more use it to treat life-threatening lung conditions. But here's the shocking truth that could save your life. This little blue pill that's helped millions of people also sends thousands to emergency rooms every year with side effects so dangerous they can cause permanent blindness, heart attacks, and even death. Whether you know it as Viagra or Revatio, if you or someone you love take sildenafil, the next 15 minutes could be the difference between using this medication safely and becoming another medical emergency statistic. What I'm about to reveal are 10 deadly side effects that most doctors never fully explain, including one that can cause an erection so painful and prolonged it requires emergency surgery to prevent permanent damage. Sildenafil is one of the most fascinating medications in modern medicine because it serves two completely different life-changing purposes. Most people know it as Viagra, the revolutionary erectile dysfunction treatment that transformed millions of men's lives and relationships. But what many don't realize is that the exact same medication, sold under the name Revatio, is also a life-saving treatment for pulmonary arterial hypertension, a rare but deadly condition where dangerously high blood pressure in the lungs can kill you within years if left untreated. Whether you're taking sildenafil for intimate health or to literally keep your heart and lungs functioning, this medication has helped millions of people reclaim their lives and health. But here's what's absolutely critical to understand: while sildenafil can be life-changing and even life-saving, it's also one of the most dangerous medications you can put in your body if you don't know what warning signs to watch for. Today we're going to explore both sides of this powerful drug, its incredible benefits that have revolutionized medicine, and the 10 terrifying side effects that could land you in an emergency room or worse. By the end of this video, you'll understand exactly how sildenafil works, why doctors prescribe it for two completely different conditions, and most importantly, what symptoms mean you need to call 911 immediately. Part 1. Uses and benefits, 30 seconds 2 minutes. Before we dive into the dangerous side effects, it's crucial to understand why millions of people depend on sildenafil and why doctors consider it one of the most important medications ever developed. Let's start with its most famous use: treating erectile dysfunction. Sildenafil works by relaxing blood vessels and increasing blood flow to specific areas of the body. For men with ED, this means the difference between a fulfilling intimate life and devastating psychological and relationship problems. The success rates are remarkable. Studies show that sildenafil is effective for about 80% of men with erectile dysfunction, regardless of the underlying cause. For many men, this medication has literally saved their marriages, restored their confidence, and given them back a fundamental part of their identity. But here's where sildenafil becomes even more fascinating: the exact same mechanism that helps with erectile dysfunction also saves lives in a completely different way. When doctors prescribe sildenafil as Revatio for pulmonary arterial hypertension, they're using its blood vessel relaxing properties to reduce the dangerously high pressure in the arteries that carry blood from the heart to the lungs. This condition affects about 500 to 1,000 people per million globally, and without treatment, same conditions that often lead men to need sildenafil in the first place. There's also a connection to something called crowded disc syndrome, where the optic nerve head is smaller than normal, making it more susceptible to blood flow problems. The vision loss from NAION is usually permanent because once optic nerve cells die, they cannot regenerate. Some people recover partial vision, but many are left with significant permanent visual impairment. There's no proven treatment that can restore vision once NAION has occurred, which is why prevention and early recognition are so crucial. Warning signs to watch for include any sudden changes in vision, such as blurriness, dimming, loss of color vision, or the appearance of blind spots. Some people experience flashing lights or see halos around lights before the vision loss occurs. If you notice any sudden vision changes while taking sildenafil, stop the medication immediately and get to an emergency room. While there's no guarantee that emergency treatment can save your vision, stopping the medication quickly might prevent the condition from affecting your other eye. Don't wait to see if your vision improves on its own. Every minute of delay could mean the difference between keeping your sight and permanent blindness. 4. Severe allergic reactions. Karen had been taking sildenafil occasionally for 6 months when something went terribly wrong. Within 30 minutes of taking her usual dose, her lips began tingling and swelling rapidly. Her throat felt tight, and she started having trouble breathing. By the time her husband found her, Karen's face was swollen beyond recognition, her skin was covered in angry red welts, and she was gasping for air. Karen was experiencing anaphylaxis, the most dangerous allergic reaction your body can have, and she had less than 15 minutes to get emergency treatment or she would die. What makes sildenafil-induced anaphylaxis so unpredictable and terrifying is that it can happen to anyone, at any time, even if you've taken the medication safely before. Your immune system can suddenly decide that sildenafil is a deadly threat that must be eliminated at all costs. When this happens, your body launches an all-out attack that ends up destroying itself instead of protecting you. The reaction typically begins with seemingly minor symptoms that people often ignore or attribute to other causes. You might notice a strange taste in your mouth, or your lips and tongue might start tingling. Some people develop an itchy feeling in their throat or feel like something is stuck there. But these early warning signs can rapidly escalate into a life-threatening emergency that requires immediate medical intervention. Your throat and tongue can swell so dramatically that your airway becomes completely blocked, making breathing impossible. The swelling doesn't stop with your throat. Your entire face can become grotesquely swollen, with your lips, eyelids, and cheeks ballooning to unrecognizable proportions. Your skin can break out in massive hives or welts that itch and burn intensely, sometimes covering your entire body. But the most dangerous aspect of anaphylaxis is what happens to your cardiovascular system. Your blood vessels can dilate so suddenly and severely that your blood pressure crashes to life-threatening levels. Your heart races desperately, trying to pump blood through your collapsing circulatory system, but it's fighting a losing battle. Without emergency treatment, your blood pressure can drop so low that your vital organs stop receiving adequate blood flow, leading to organ failure and death. The psychological symptoms of anaphylaxis are equally terrifying. Many people experience an overwhelming sense of impending doom, as if they know they're about to die. Severe confusion can set in as your brain struggles to function with inadequate blood flow and oxygen. Some people become agitated and panicky, while others become drowsy and difficult to rouse. Nausea and vomiting are common, and some people experience severe abdominal cramping and diarrhea as their entire digestive system goes into shock. What makes anaphylaxis particularly deadly is how rapidly it can progress from mild symptoms to complete cardiovascular collapse. Some people go from feeling slightly unwell to being in life-threatening shock within just 10 to 15 minutes. The reaction can be unstoppable once it begins, and even people who receive immediate emergency treatment don't always survive. If you experience any swelling of your face, lips, tongue, or throat after taking sildenafil, don't wait to see if it gets better. Call 911 immediately. Tell the operator that you're having an allergic reaction to medication and suspect anaphylaxis. If you have an EpiPen, use it right away, but you still need emergency medical treatment even if the EpiPen seems to help. Time is literally the difference between life and death in anaphylactic reactions. 5. Dangerous blood pressure changes. William was a 59-year-old executive who had been managing his high blood pressure with medication for years. When he started taking sildenafil, he thought it might actually help his blood pressure since his doctor mentioned it could relax blood vessels. One evening, about an hour after taking his dose, William stood up from his desk and immediately felt dizzy and lightheaded. Within seconds, his vision went black and he collapsed to the floor, hitting his head on his desk on the way down. William's wife found him unconscious with a severe head injury that required emergency surgery. What William didn't realize was that sildenafil had caused his blood pressure to drop so suddenly and severely that his brain was starved of oxygen, causing him to faint and suffer a life-threatening injury. Dangerous blood pressure changes are one of the most common but underestimated side effects of sildenafil. The medication works by relaxing blood vessels throughout your entire body, not just in the areas you want to treat. When these blood vessels suddenly dilate, your blood pressure can plummet so quickly that your body can't compensate fast enough. This condition, called severe hypotension, can be just as dangerous as having high blood pressure, if not more so. Your brain requires a constant supply of oxygenated blood to function properly, and when your blood pressure drops too low, your brain literally starts to shut down. The dizziness and lightheadedness that many people experience with sildenafil isn't just an inconvenience, it's a warning sign that your brain isn't getting enough blood. Some people describe feeling like they're going to pass out, or they experience a strange floating sensation. Others notice that their vision becomes blurry or that they see stars or flashing lights. But the real danger comes when you change positions, especially when standing up quickly. This action, which normally causes only a slight temporary drop in blood pressure, can trigger a dramatic blood pressure crash in people taking sildenafil. The medical term for this is orthostatic hypotension, and it can cause you to faint without warning, leading to dangerous falls and serious injuries. What makes this particularly dangerous is that the fainting episodes can happen anywhere, at any time. People have collapsed while driving, walking down stairs, or even just getting out of bed. The falls can result in broken bones, head injuries, and other trauma that can be life-threatening, especially in older adults. The risk becomes even more severe when sildenafil interacts with other medications that also affect blood pressure. Alpha blockers, used to treat enlarged prostate, can combine with sildenafil to cause catastrophic drops in blood pressure. Blood pressure medications, diuretics, and even some antidepressants can amplify sildenafil's hypotensive effects. Alcohol makes the situation even worse by further dilating blood vessels and impairing your body's ability to regulate blood pressure. Signs that your blood pressure has dropped to dangerous levels include severe dizziness, feeling faint or lightheaded, confusion, nausea, rapid or weak pulse, and cold, clammy skin. If you experience any of these symptoms while taking sildenafil, sit or lie down immediately and elevate your legs if possible. If symptoms don't improve quickly or if you actually faint, call 911 immediately. Don't try to drive yourself anywhere or walk around, as you could collapse without warning. 6. Hearing loss and deafness. Marcus was a 48-year-old musician whose entire life revolved around sound. One Saturday morning, 2 hours after taking sildenafil, Marcus noticed a strange ringing in his left ear. By afternoon, the ringing had become a deafening roar, and he realized he couldn't hear anything from that ear. Within 24 hours, Marcus had lost complete hearing in his left ear, and the hearing in his right ear was starting to fade. The medication that was supposed to improve one aspect of his life had destroyed his career and his passion for music forever. Marcus was experiencing sudden sensorineural hearing loss, a rare but devastating side effect of sildenafil that can cause permanent deafness. Sudden sensorineural hearing loss, or SSNHL, occurs when the delicate hair cells in your inner ear are damaged or when blood flow to your inner ear is compromised. Sildenafil can trigger this by affecting the tiny blood vessels that supply your inner ear with oxygen and nutrients. These hair cells are incredibly fragile and cannot regenerate once they're damaged, which is why hearing loss from SSNHL is often permanent. The condition typically affects one ear first, though both ears can be involved in severe cases. The hearing loss can happen gradually over several hours, or it can occur suddenly. Some people notice complete deafness in one ear when they wake up in the morning. Along with the hearing loss, many people experience tinnitus, which is a constant ringing, buzzing, roaring, or hissing sound in the affected ear. This tinnitus can be incredibly loud and distracting, making it difficult to concentrate, sleep, or function normally. What makes SSNHL so frightening is that it's often the first and only warning sign of serious inner ear damage. Unlike gradual hearing loss that develops over years, SSNHL strikes without warning and can cause profound deafness within hours. Some people also experience vertigo or dizziness as the balance organs in their inner ear are affected. The psychological impact of sudden hearing loss can be devastating, especially for people whose careers or hobbies depend on their hearing. Musicians, teachers, phone operators, and countless others have had their lives turned upside down by this side effect. The social isolation that comes with hearing loss can lead to depression, anxiety, and withdrawal from activities that were once enjoyable. The medical treatment for SSNHL is limited and must be started immediately to have any chance of success. High-dose corticosteroids are the standard treatment, but they only work if administered within the first few days after hearing loss occurs. Even with prompt treatment, many people don't recover their hearing completely, and some don't recover at all. The longer you wait to seek treatment, the less likely you are to regain your hearing. Warning signs of SSNHL include sudden hearing loss in one or both ears, severe tinnitus that starts suddenly, a feeling of fullness or pressure in your ear, and dizziness or balance problems. Some people notice that sounds seem muffled or distorted, or they have trouble understanding speech even though they can hear sounds. If you experience any sudden changes in your hearing while taking sildenafil, especially if it's accompanied by tinnitus or dizziness, stop the medication immediately and seek emergency medical attention. Don't wait to see if your hearing returns on its own. Every hour of delay reduces your chances of recovery. Consider any sudden hearing loss a medical emergency that requires immediate treatment. 7. Stroke and brain problems. Edward was a healthy 55-year-old lawyer who had no history of neurological problems. One evening, about an hour after taking sildenafil, Edward began having trouble speaking. His words came out slurred and confused. His wife noticed that the right side of his face was drooping and his right arm seemed weak. By the time they reached the hospital, Edward was having a massive stroke that would leave him partially paralyzed and unable to practice law ever again. The medication that was supposed to improve blood flow had triggered a blood clot that blocked a major artery in his brain, causing irreversible damage to his brain tissue. Sildenafil's effects on blood vessels throughout your body can have devastating consequences for your brain. While the medication is designed to improve blood flow, it can also create conditions that promote blood clot formation or cause dangerous changes in brain blood pressure that trigger strokes. There are two main types of strokes that sildenafil can cause: ischemic strokes, where a blood clot blocks blood flow to part of your brain, and hemorrhagic strokes, where a blood vessel in your brain ruptures and bleeds. Both types can be fatal or cause permanent disability. Ischemic strokes occur when sildenafil's effects on your cardiovascular system promote the formation of blood clots. The medication can cause changes in blood flow patterns and blood vessel walls that make clots more likely to form. These clots can then travel to your brain and block critical arteries, starving brain tissue of oxygen. Within minutes of being deprived of oxygen, brain cells begin to die permanently. The area of your brain that's affected determines what functions you'll lose. You might become paralyzed, lose your ability to speak, develop memory problems, or lose control of basic body functions. Hemorrhagic strokes are equally dangerous and occur when sildenafil causes blood vessels in your brain to rupture. The sudden changes in blood pressure that the medication can cause put enormous stress on delicate brain blood vessels. If these vessels are already weakened by conditions like high blood pressure or aneurysms, they can burst under the additional pressure. When this happens, blood pours into your brain tissue, causing swelling, pressure, and destruction of brain cells. The bleeding can be so severe that it compresses vital brain structures and can be rapidly fatal. The warning signs of stroke are critical to recognize because immediate treatment can sometimes prevent permanent damage. The acronym FAST helps remember the key symptoms. Face drooping, one side of the face droops or is numb. Arm weakness. One arm is weak or numb. Speech difficulty. Speech is slurred or strange, and time to call emergency services. Other warning signs include sudden severe headache, sudden confusion or trouble understanding, sudden vision problems, sudden trouble walking or loss of coordination, and sudden dizziness. What makes strokes particularly tragic is that the damage is often permanent and irreversible. Unlike other organs that can heal from injury, brain tissue that dies from a stroke cannot regenerate. People who survive strokes may face lifelong disabilities including paralysis, speech problems, memory loss, personality changes, and loss of independence. The emotional and financial toll on families can be devastating, and many stroke survivors struggle with depression and social isolation. Risk factors that increase your chances of stroke while taking sildenafil include high blood pressure, heart disease, diabetes, high cholesterol, smoking, and previous history of stroke or heart attack. Unfortunately, many men who use sildenafil have several of these risk factors, making them particularly vulnerable to this complication. If you experience any sudden neurological symptoms while taking sildenafil including weakness, numbness, confusion, difficulty speaking, vision problems, or severe headache, call 911 immediately. Don't wait to see if symptoms improve, and don't drive yourself to the hospital. Stroke is a medical emergency where every minute counts, and rapid treatment can mean the difference between recovery and permanent disability. 8. Liver damage and toxicity. Patricia was a 52-year-old accountant who had been taking sildenafil prescribed by her doctor for pulmonary arterial hypertension. After 8 months on the medication, Patricia began feeling unusually tired and noticed that her urine had become dark brown. When her husband pointed out that the whites of her eyes looked yellow, Patricia initially dismissed it as fatigue from working long hours. Within a week, Patricia was so exhausted she could barely function, and blood tests revealed that her liver was severely damaged. Her doctor immediately hospitalized her, warning that she might need an emergency liver transplant to survive. Patricia had developed drug-induced hepatotoxicity from sildenafil, a rare but potentially fatal condition where the medication literally poisons your liver cells. Your liver is your body's primary detoxification center, working around the clock to process medications, filter toxins from your blood, and produce essential proteins that keep you alive. When you take sildenafil, your liver has to break down and eliminate the medication from your system. For most people, this process works fine, but in some cases, either the medication itself or the byproducts created during its breakdown can be toxic to liver cells. This toxicity can cause inflammation, cell death, and eventually complete liver failure if not recognized and treated immediately. What makes sildenafil-induced liver damage so dangerous is how silently it develops. Your liver doesn't have pain receptors, so you won't feel any discomfort even as your liver cells are dying. The damage often progresses for weeks or months before any symptoms appear, and by the time you notice problems, your liver function may already be critically compromised. The earliest signs are often subtle and easy to dismiss as stress or overwork, unusual fatigue that doesn't improve with rest, loss of appetite, or mild nausea. The first visible sign of serious liver damage is usually jaundice, the yellowing of your skin and the whites of your eyes that occurs when your damaged liver can't process waste products properly. This yellowing happens because bilirubin, a waste product that should be processed by your liver, starts building up in your bloodstream and tissues. Along with jaundice, your urine becomes dark brown or tea-colored as excess bilirubin is filtered by your kidneys. Your stools may become pale or clay-colored because your damaged liver isn't producing enough bile for proper digestion. The fatigue associated with liver damage is unlike normal tiredness, it's a bone-deep exhaustion that sleep can't relieve. You might feel completely drained after simple activities like taking a shower or walking upstairs. This happens because your liver can't produce the proteins and enzymes your body needs for energy metabolism. Some people develop severe pain in their upper right abdomen, just below the rib cage where the liver is located. This pain can be constant and excruciating, often getting worse with movement or deep breathing. Nausea and vomiting can become so severe that you can't keep food or water down, leading to dangerous dehydration and weight loss. What's truly terrifying about liver failure is how quickly it can become fatal once it reaches a critical point. Your liver performs over 500 essential functions, including blood clotting, protein synthesis, and toxin removal. When these functions fail, you can develop life-threatening complications including internal bleeding, brain swelling, kidney failure, and infections. Without immediate treatment or liver transplantation, liver failure is often fatal. The tragedy is that liver damage from medications is often preventable with proper monitoring. Regular blood tests can detect liver problems before they become life-threatening, but many people taking sildenafil don't receive adequate monitoring. If you notice yellowing of your skin or eyes, dark urine, pale stools, severe fatigue, or upper abdominal pain while taking sildenafil, stop the medication immediately and seek emergency medical attention. Early detection and discontinuation of the medication can sometimes allow your liver to heal, but waiting too long can result in irreversible damage or death. 9. Kidney problems and failure. Anthony was a 64-year-old retiree who had been taking sildenafil for both erectile dysfunction and mild heart problems for over a year. He started noticing that he wasn't urinating as frequently as usual, and when he did urinate, the amount seemed much less than normal. Over the next few weeks, Anthony developed swelling in his legs and feet that got progressively worse. When he finally saw his doctor, blood tests revealed that Anthony's kidney function had declined dramatically. He was in the early stages of kidney failure and would likely need dialysis within months. The sildenafil that was supposed to improve his quality of life was slowly destroying the organs that were keeping him alive. Kidney problems from sildenafil can develop in two dangerous ways. The medication can directly damage kidney tissue, or it can accumulate to toxic levels in people whose kidneys aren't working properly to begin with. Your kidneys are responsible for filtering sildenafil out of your bloodstream and eliminating it from your body through urine. If your kidney function is compromised even slightly, the medication can build up to dangerous levels, creating a vicious cycle where sildenafil damages your kidneys, which makes them less able to clear the drug, leading to even more kidney damage. What makes kidney problems particularly insidious is that kidney damage often occurs gradually and silently. Your kidneys have remarkable reserve capacity, meaning they can lose up to 75% of their function before you notice any symptoms. By the time you realize something is wrong, the damage may already be irreversible. The early signs are subtle and easy to dismiss. You might notice slight changes in your urination patterns, mild fatigue, or occasional swelling in your ankles. Most people attribute these symptoms to getting older or being less active. As kidney damage progresses, the symptoms become more obvious but are still often misunderstood. You might notice that you're urinating much less than usual, or that your urine has become foamy, dark, or has an unusual odor. The foamy urine occurs because your damaged kidneys are allowing protein to leak into your urine, creating bubbles that don't dissipate quickly. Swelling, called edema, typically starts in your ankles and feet but can progress up your legs to your hands, face, and even your lungs. This swelling happens because your kidneys can't properly balance fluid and electrolytes in your body anymore. The fatigue associated with kidney failure is overwhelming and progressive. As waste products that should be filtered by your kidneys build up in your bloodstream, you feel increasingly tired, weak, and mentally foggy. Some people develop a metallic taste in their mouth, persistent nausea, or loss of appetite as toxins accumulate. Your skin might become itchy and dry as waste products are deposited in your tissues. Advanced kidney failure can cause dangerous complications including high blood pressure, anemia, bone disease, and heart problems. When your kidneys can no longer maintain the proper balance of electrolytes like potassium and phosphorus, you can develop life-threatening heart rhythm abnormalities. The buildup of fluid in your lungs can make breathing difficult and can be fatal without immediate treatment. What makes kidney failure so devastating is that it's often irreversible. Unlike your liver, which has remarkable regenerative capacity, kidney tissue that's been destroyed typically cannot be restored. Once you develop significant kidney failure, you may need dialysis several times a week for the rest of your life, or you may need a kidney transplant. Both options significantly impact your quality of life and life expectancy. Risk factors that increase your chances of kidney problems while taking sildenafil include diabetes, high blood pressure, heart disease, being over 65, and already having some degree of kidney impairment. Dehydration from illness or other medications can rapidly worsen kidney function in people taking sildenafil. If you notice decreased urination, unusual swelling, persistent fatigue, changes in urine color or foam, nausea, or a metallic taste in your mouth while taking sildenafil, see your doctor immediately for blood tests to check your kidney function. Early detection and medication adjustment can sometimes prevent permanent kidney damage, but waiting too long could mean a lifetime of dialysis or the need for a kidney transplant. 10. Seizures and neurological problems. Christopher was a 46-year-old teacher with no history of seizures or neurological problems. One evening, about 2 hours after taking sildenafil, Christopher was watching television when he suddenly became confused and disoriented. His wife noticed that he was staring blankly and not responding to her questions. Within seconds, Christopher's body began convulsing violently. He was having a grand mal seizure that lasted nearly 5 minutes. By the time paramedics arrived, Christopher had bitten his tongue severely and was completely unconscious. At the hospital, doctors discovered that sildenafil had triggered dangerous changes in his brain's electrical activity, causing a seizure that could have been fatal. This was just the beginning of Christopher's nightmare. Over the following months, he continued to have seizures despite stopping the medication, and he eventually developed chronic epilepsy that ended his teaching career. Sildenafil-induced seizures are rare but extremely serious neurological emergencies that can cause permanent brain damage or death. The medication can trigger seizures by affecting blood flow to the brain, altering the brain's electrical activity, or by interacting with other medications or medical conditions. When a seizure occurs, the normal electrical patterns in your brain become chaotic and uncontrolled, causing a wide range of symptoms from mild confusion to violent convulsions that can be life-threatening. There are several types of seizures that sildenafil can trigger, each with different symptoms and levels of danger. Generalized tonic-clonic seizures, also known as grand mal seizures, are the most dramatic and dangerous type. During these seizures, you lose consciousness completely and your entire body convulses violently. Your muscles contract and relax rapidly, causing your arms and legs to jerk uncontrollably. You might bite your tongue, lose control of your bladder or bowels, and stop breathing temporarily. These seizures typically last 1 to 3 minutes, but they can continue longer and become life-threatening. Focal seizures affect only part of your brain and can cause more subtle symptoms that are often overlooked or misinterpreted. You might experience sudden confusion, memory problems, strange sensations, or unusual behaviors. Some people have partial seizures where they remain conscious but experience strange smells, tastes, or visual disturbances. Others might have complex partial seizures where they lose awareness and perform repetitive movements like lip smacking or hand wringing. What makes sildenafil-induced neurological problems particularly dangerous is that they can cause permanent changes to your brain. Even a single seizure can cause brain damage, and people who have seizures are at increased risk of developing chronic epilepsy. The lack of oxygen to your brain during a seizure can kill brain cells permanently, and repeated seizures can cause progressive cognitive decline, memory problems, and personality changes. The risk of seizures increases significantly when sildenafil interacts with other medications, particularly those that affect the central nervous system. Antidepressants, anti-anxiety medications, pain medications, and even some antibiotics can lower your seizure threshold when combined with sildenafil. Alcohol and recreational drugs dramatically increase the risk, as do medical conditions like diabetes, kidney disease, or previous head injuries. Warning signs that you might be developing neurological problems from sildenafil include sudden confusion, memory problems, difficulty concentrating, unusual headaches, dizziness, changes in vision or hearing, or any strange sensations or behaviors. If you experience a seizure while taking sildenafil, this is a medical emergency that requires immediate treatment and complete evaluation to prevent future seizures and determine if any brain damage has occurred. Sildenafil has revolutionized treatment for both erectile dysfunction and pulmonary arterial hypertension, improving millions of lives worldwide. But as we've seen today, this powerful medication can also cause devastating side effects including heart attacks, permanent blindness, hearing loss, liver failure, and even death. The key to using sildenafil safely is understanding both its benefits and its risks, working closely with qualified medical professionals, and knowing when to seek emergency help. Watch for heart problems, prolonged erections, sudden vision or hearing loss, severe allergic reactions, dangerous blood pressure changes, and neurological symptoms. These aren't minor side effects to ignore, they're medical emergencies. Share this information with anyone considering or currently taking sildenafil because knowledge can literally save lives. Subscribe for more critical health information, and remember, never start or stop any medication without consulting your doctor first. Your health and safety should always come first. Hook and AMP. Introduction script. Sildenafil uses benefits and AMP, side effects video.